So the next question is, are there any trials for older males living with relapsing MS that you know of? And by trials,
Yes.
I think they, yeah.
So traditionally, when we study multiple sclerosis, particularly relapsing multiple sclerosis, the age range, excuse me, that we enroll is 18 to 55.
Mm,
And
yeah.
the reason that traditionally we enroll 18 to 55 is not because 17-year-olds don't have MS or 56-year-olds don't have MS. They do, but it has to deal with the statistical likelihood that the human being is going to have change during the period of time of the trial.
Mm,
So someone who is, let's say, 65 with MS is statistically less likely to have an attack than someone who is, say, 45. So when you're enrolling the trial, you're trying to capture events. You need statistically, mathematically, people to have events so you can compare excuse me, two
mm,
different treatments.
mm.
And so you tend to enroll patients between 18 and 55.
Okay.
There's a
Yeah.
problem with that. There's actually like a million problems with that, but there's two big problems with that. Number one, people continue to have MS after 55. So studying people beyond 55 is very valid because we want to be able to match patients with experience in trials. The second thing is, even though the attack risk goes down when you're a little older, the risk of progression goes up. So we need
Mm,
to be studying those people. We just need to be studying something different.
yeah.
And that's what you're seeing in modern clinical trials. You're starting to see trials that extend enrollment from 55 to 58 or to 60, or even in some rarer cases, like into the early 60s, like 62.
Mm,
Now, the people that are listening to this might be saying, well, gosh, Aaron, it's not like 60's old. What about someone who's 61? And I would say to you, yes, yes, I agree. But I am glad that we're starting to see exploration into slightly older age groups because that's very, very important. Are there trials available for you right now? Yes. And it has nothing to do with being a boy, but there are trials available for people over 55 in relapsing MS, and we're doing some of them at my center right now.
yeah. How would somebody find out about those? Would they speak to their neurologist or?
So I think that answer is probably country specific in
Yeah.
some respects. Let me share the answer from the United States, but I'm sure that many of the same tools could be used in other parts of the world. So
Mm,
one way to do it is to talk to your neurologist and say, hey, are you aware of any trials that I might be eligible for? Another way to do it is to reach out to some of the charitable organizations like Overcoming MS, like National MS Society, like these organizations. Sometimes you guys have a repository of, hey, I'm aware of the trials in this region. Let me pass that information on. So that's a resource. In the United States, there's a website maintained by our government called clinicaltrials.gov, G-O-V.
mhm,
And clinicaltrials.gov is a record of every MS clinical trial anywhere. And so that's a really easy resource. You can go to clinicaltrials.gov and then search multiple sclerosis, and you'll see where all different trials are being done throughout the universe. So those are some ways of trying to do it. Another
uh,
way, if you live near a large academic institution, like a large university, call the Department of Neurology in that university and say, hey, are you guys doing any trials? Those are ways that you could learn about that.
yeah, fantastic. That's some really great tips there.